I'm Clive Morgan. I'm the Managing Director of the All Wales Medical Genomics Service. It's the only national service in the UK. We're very proud of that. In terms of adoption of new technology, an expansive portfolio of tests, it is a world-leading, a globally leading service. So again, it's an asset that Wales should be very proud of.
I'm Vinod Verghese. I'm a consultant clinical geneticist in the All Wales Medical Genomics Service. My special area of interest is prenatal genetics, and I'm also the training program director for the specialty training program for genetics in Wales. We see patients and families who have been referred to us either because of a family history of a genetic condition, or they themselves have been diagnosed with a genetic condition, and they want to know what it means for them, what it means for other members of the family, what it may mean for their future children. Sometimes we are also referred patients who other clinicians think about the possibility of a genetic condition, and they're referred in for a diagnosis.
So the COVID pandemic, being based in science, we were aware that something was going on, and we were following the science around the infection, and we were looking at the diagnostics and what could be done. So we've been tracking it for quite a while. Obviously then we were aware of what was going on within the organisation, and although we were slightly insulated from that because we're not frontline as in terms of patient facing in areas like ICU or in the emergency department, we were aware that things were changing over there, and of course we were picking a lot up from the UHB and also from media. So we started to develop our plans. Now, our plans were primarily around keeping urgent services going, so a lot of our prenatal work and cancer work wasn't going to stop.
I think it has definitely made us think out of the box, in terms of how can we cope. And now that we have been doing more virtual clinics, so we're having telephone consultations rather than face-to-face appointments. In fact, this is something that we have thought about before, but obviously the current situation has forced it upon us. And but once we have started, we've had, the ones that I have done telephone consultation, I've had some patients saying that this has been very helpful. I've had most of my queries already answered, so I don't need to come to a hospital and find parking and travel till there and things. So this is something that we will be, it'll be part of our clinical practice going forward. So I think, when we are back to routine service, whenever it is going to happen, I think it'll be a new service rather than the old one. I think it'll be a new genetic service which incorporates several other aspects that we have learned during this time.
We're seeing now that, and we're certainly anticipating, the outcomes will be equal. So that gives us a lot more flexibility. We can schedule patients differently. And again, for patients who want to be treated closer to home, it is beneficial for the patients, and it's certainly beneficial for our staff as well. The new way of working will be embedded. It's seen as positive, although it was driven by a crisis, and we say never waste a good crisis. This will be sustainable. Morale has been very good. There's been some fantastic leadership, a lot of open dialogue. I think staff feel open to discuss their anxieties and concerns, but there's been a lot of innovative practice, again a lot of problem solving, but I guess that the key thing is the willingness to make this work.